More on this is Dr. Sheldon Salaba, president of the Ontario Association of Optometrists. Dr. Salaba, thank you so much for joining us to talk about this. 3 decades of underfunding. That's what the OAO is saying. Tell us how we got to this point.
You know, I just think you have governments in Ontario that don't value the eye care services and the healthcare services that we provide the public in Ontario, and they've chosen to ignore us. And that's how this problem has gone on for so long. We've been trying to call the Ontario government and engage with them over the last 32 years. They will not pick up the phone. Do you know that the last time that we heard from the government was August 29th. So we're at about 68 days that OHIP patients in Ontario haven't had access to primary eye care services. There has not been one call from the government or the ministry. I sent Christine Elliott my personal cell phone number on Wednesday. I still haven't received a call. We're really waiting for them to act and actually show us a sign of good faith, pick up the phone and enter a robust negotiation process to help us fix this problem.
And Dr. Salaba, we know that the Ontario government did offer a one-time $39 million payment in an effort to mitigate the underfunding that's been happening for decades. But this averages out to just over $1 per exam for every optometry service performed over that period. Is that correct? And may I ask, what is it you want to see brought to the table?
So you are absolutely correct with that payment. I think it was complete mismanagement of taxpayer money. They sent money to over 150 deceased and retired optometrists. It does nothing to create a sustainable eye care system in this province. 2,200 optometrists sent letters to the ministry saying that they didn't consent to that money being deposited into our accounts. We never asked them for anything retroactive. And we wanted that money to be used to create a sustainable eye care system for our patients in the future. Sending it to deceased people, I don't know how that helps in any way, shape, or form. And over that decade that the $39 million is responsible for, optometrists spent over $1 billion providing eye care services to patients. So it doesn't equate, and we're really looking at sustainable funding in the future.
Okay, and Dr. Salaba, I know that the Ontario Association of Optometrists, you conducted your own independent study. Can you tell us more about the findings from that study?
Yeah, certainly. So we evaluated 73 clinics across the province, representing about 250 optometrists practicing inside of them, which is a representative sample of about 10% of practicing optometrists. And it was geographically distributed across the province based on population density. We only accounted for expenses that are in relation to providing eye exams. It was performed by BDO, which is a national accounting firm, and the numbers are accurate, and they came in at on average $75. And the government doesn't want to recognize that. But when we look at how other provinces that provide provincially insured primary eye care services by optometrists fund them, Ontario is by far the lowest. $77 in Manitoba, $106 in Quebec, performing the exact same service on a senior.
Very quickly, Dr. Salaba, we don't have much time, but I just want to ask you this directly. Do you think that the provincial government is discriminating eye doctors in Ontario?
Of course I do. I don't understand how the government can expect the service provider to pay to see the patients. They're only partially funding the services. This is their responsibility to resource. And they need to stop saying that they're acting in good faith when they're not, and actually turn around and show us a true sign of good faith and start by picking up the phone so we can get back to seeing our patients.
Okay, well, Dr. Salaba, I hope that there's a resolution soon. Thank you so much for your time this afternoon. Take care.
Thanks for having me.